Good afternoon, folks. Today's topic A is discussing questions to ask when on a tour of assisted living. So here we go. Assisted living questions to ask first is essentially a guide post. It signals the crucial starting point for families and older adults exploring assisted living options rather than being overwhelmed by glossary, brochures, or surface level amenities. It encourages people to begin with the most fundamental practical questions that determine whether a community can truly meet their needs. It's about setting priorities, clarifying care, safety, costs, and daily life before emotions or experience appearances sway the decision. Why these questions matter. Assisted living communities are not uniform. They differ in staffing, models, medical oversight, services, and even philosophies of care. The surrounding page emphasizes medication management as a particularly crucial area. Medication errors are one of the most common risks in senior care, and the way a community handles prescriptions directly impacts both safety and cost. For example, some states require licensed nurses to administer medications. While others allow trained but non-licensed staff. Storage practices vary. Medications may be kept centrally or in residences' rooms, each with different risks of mixed ups and mix-ups. Policies on missed doses, prescription changes, or complex schedules can determine whether a residence evolving health needs can be accommodated. If a community cannot handle certain medications, residents may not be forced to residents may be forced to relocate, which is disruptive and emotionally taxing. That's why these First questions are just practical. They're protective. Key topics. The first question should cover medication and medical care. Who administers medications and what training license do they have? How are medications stored and tracked to prevent errors? What happens if a dose is missed or a prescription changes suddenly? Can the community manage complex treatment or regimens or specialized medications? Staffing and training. What is the staff to resident ratio, especially at night? How often are nurses on site? How quickly can emergencies be addressed? What is staff turnover like, and how are caregivers trained in dementia or chronic illness care? Services and limits. Which services are included in the monthly fee? Meals, housekeeping, transportation, therapy. What services cost extra and how much? Can the community adapt as care needs increase, or is there a threshold where residents must move? Safety and health protocols. What measures are in place for fall prevention and infection control? How are residents supervised at night? What is the procedure for medical emergencies? Costs and contracts. What is the monthly fee and what triggers rate increases? Are deposits refundable? How are long-term care or memory care transitions handled financially? Daily life and quality of life. What are meal options and how flexible are they? Guys, these are questions you have to bring up when you first go for a tour to get a feel for the place. Because you as people put your family members, loved ones in these facilities, you have to make sure that it fits them as far as care needs and as far as comfort goes. So that's the reason I'm doing this one this afternoon for you. What kind of activities and social programs are offered? What does the community support? Emotional well-being and family connections. Transition and discharge policies. What happens if a resident's health declines beyond the community's capacity? How are families notified? and it involved in decisions about moving or additional care. Those have to come up too, guys. Those kinds of questions have to be addressed also in the first uh, initial go through and sit down with folks. Okay, how to use the article title in practice. Think of assisted living questions to ask first as a checklist starter. When touring a facility or speaking with staff, begin with these fundamental questions before diving into lifestyle details. They help you quickly identify uh, deal breakers such as inadequate medication management or unclear costs structures. So if you don't waste time on communities, they can meet they can't meet care needs. Once these essentials are clarified, you can move on to more personalized questions about amenities, food, or cultural fit. In short, this phase is about front loading the most consequential questions, so families make informed, safe, and sustainable choices. All right, guys, that's your A for today. We'll be back on later with B. For now, Gator Wellness. Take care, folks.